From the Daniel K. Inouye Asia-Pacific Center for Security Studies in Honolulu, Hawaii, this is the Security Nexus webinar. I'm your host, James Minnich, Colonel U.S. Army, retired and professor at the Daniel K. Inouye Asia-Pacific Center for Security Studies. Today is Tuesday, November 7th. The World Health Organization defines global health security as the activities required, both proactive and reactive, to minimize the danger and impact of acute public health events that endangers people's health across geographical regions and international boundaries. The Indo-Pacific region, a region of consequence, encompasses the World Health Organization Southeast Asia region and the Western Pacific region, and is inhabited by approximately 4 billion people across 48 distinct countries and territories. This expansive area is marked by consistent occurrences of public health crises that stem from a wide array of threats, including established and emerging infectious diseases, the rise of antimicrobial resistance, and extreme climatic events. Today on the Security Nexus webinar, we explore the multifaceted nature of health security and how it transcends traditional boundaries. We will discuss current health security challenges facing the Indo-Pacific and emphasize the interconnectedness of health and security in the region. We'll delve into the successful health security initiative while touching upon real-world examples of practical approaches that have made positive impacts. Furthermore, we'll explore the role of technology and innovation in enhancing health security. Our guest will provide insights into how cutting-edge solutions can be harnessed to address health challenges, making the Indo-Pacific region more resilient. At registration, our audience was invited to submit questions. Thank you for those submissions, and we'll turn to them later in the show. Our guest is Dr. Sebastian Kevany, an associate professor here at the Daniel K. Inouye Asia-Pacific Center for Security Studies, and a respected expert in the field of global health security. Dr. Kevany, with a wealth of knowledge and experience in health security, has conducted more than 100 global health and development missions to Africa, the Middle East, Eastern Europe, Asia, and the South Pacific. Welcome, Dr. Sebastian Kevany. It's an honor to have you on today's program.
Thank you, James. Thank you so much for having me, and greetings to all the guests.
Bass, I'd like to start by reading for a couple minutes from your 2020 memoir, Fever in the Jungle. At the foreword, which is written by Sir Henry Grattan Bellew, he says this: lifelong friendships can happen in strange circumstances. Mine with the Kevany family started while waiting for the boat on the North Wall, Dublin, as John Kevany and I were departing for Ampleforth College in Yorkshire. It was 1945, and we were part of the Irish schoolboy contingent, setting off for 5 years of public schooling. Some years later, I took off for Africa in the early 1950s to farm, whilst John chose North and South America to further his medical studies. After that, we used to meet up back in Dublin over the years, when our love for trout fishing brought us together on summer evenings in County Wicklow. We'd bring each other up to date on the comings and goings of our respected sons and daughters. Sebastian was off surfing the shores of California, whilst dipping his finger in things medical. Perhaps he might, we speculated, follow his father's footsteps. Bassi, as he's widely known, chose Africa and epidemiology, coupled with public health, as his platform. He would be working along parallel lines with his father, but perhaps out on the occasional tangent as well. His laid-back but steely personality, not to mention his footloose style, soon attracted the powers that be in the World Health Organization and elsewhere. They needed a troubleshooter to confront the ever-style challenges of HIV/AIDS, malaria, tuberculosis, and Ebola that were peaking above the dust clouds and pollution of Africa. Bassi was their man. And in this superbly chronicled memoir, tells of the many hardships encountered on his way, along with comical and outlandish adventures, and the occasional party as well. It's an eye-opener and something his late father, a man who was my best friend, would be immensely proud of. Signed by Sir Henry Grattan Bell in November 2020. Bass, tell us your story, or in other words, give us the wave top journey that took you into and through this global health security world and landed you here at DKI APCSS in January 2020. Bass.
Well, thank you, James. And one thing I can say straight away, simple answer is none of it was planned. Like so many resumes or CVs that people present that look so organized and chronological. In fact, there is a chaos underlying it all and an unpredictability. And it took plenty of good fortune, a couple of risks along the way to make it here. But the short answer is that my dad was obviously a big influence on me, as was Sir Henry. So thank you for quoting. And with my dad's passing in particular, I decided, okay, I better fast track myself away from my old life into continuing this work. The easiest way seemed to be to go to South Africa, not just to study at the University of Cape Town, but to gain exposure to the health challenges, not just of South Africa, but of the region, as well as getting just such a great education. And from there, again, good fortune, I moved back to San Francisco via Ireland and was immediately dispatched on a series of missions to Zimbabwe, Tanzania, Thailand, and back to South Africa again. The political instability in some of these places gave me valuable experience in what you might call conflict, post-conflict settings, an introduction, if you will, into that realm. So from there, Sudan, South Sudan, Sierra Leone, Iraq, Afghanistan, many other challenging environments. And of course, in those places, you face the twin challenges of health, infectious disease, I should say, and security issues. So in a nutshell, that is what brought me here. And I'm so pleased that the path led me to Hawaii.
Bass, we're fortunate that you've joined us, and thank you for sharing that story with us. You mentioned challenges, and in fact, when I was reading through your memoirs, I shared some of those that you wrote about in Afghanistan. It brought back some of my own memories. But when you think about those challenges, could you share some insights into the current health security challenges that face us here in the Indo-Pacific?
Absolutely. Each country, you mentioned Afghanistan, has its own challenges, no question. And it's hard to generalize in terms of a region. However, Indo-Pacific does face its own challenges. It is, many resource poor areas, many what you would call, I think, can still be called developing countries. And of course, historically, even in recent history, the region has been an incubator for a new wave of infectious disease. Not just regionally, but throughout the world. But I think if we zoom out from the region, it's the same challenges that face so many areas, so many countries. It's to do with globalization, human mobility, population growth, proximity to nature, climate change, even gender issues can be connected to health security in the Indo-Pacific and the world.
Interesting. In your self-introduction, you even spoke about this interconnectedness of health and security and how that resonated with you as you sought to pursue this field. Could you elaborate on how these two aspects are intertwined and why understanding this link is crucial for effective health security measures?
I mean, I think like so many things that we deal with here at the center and that academia is dealing with more and more these days, we're moving away from educational, academic, even governance models that are siloed, stovepiped, categorized towards more interdigitation, interdepartmentalism. And so what used to be something that explicitly and implicitly separated out public health from national security has now become something that is very closely entwined. Same as again with something like climate change. Who would have thought a generation ago that we would be thinking of the environment in terms of national and international security? I'll just give you an example that I use in the plenaries here. And it's not, there's no right or wrong, but you've got a house. Let's say you've got a house, you know, you may have a family, but your house has occupants. You live in the house. You can spend as much as you want on the security of that house. You can build a moat, you can have a drawbridge, you can have barbed wire, you can have surveillance cameras. But without health of the occupants, what's the use of the security? And vice versa. You can have the most perfectly healthy occupants, but a very insecure house. And so to try and separate health and security, I think that's the fallacy. Yeah. In fact, they're fundamentally connected on every level.
I appreciate that analogy. Most of us, all of us probably, can relate to a family setting. Made me take inventory of my own. As we think about the innovations, the health security initiatives that have been undertaken, I wonder if you might share with us some of those real world examples where you, even in your own missions, where you have seen these health security initiatives matter. And then if you can also relate it to the region, that would be helpful.
You know, what amazes me is how broad the definition of health security can be and has become, particularly again in the Indo-Pacific region. So in my own experience, I have been dispatched to Papua New Guinea a couple of times, Samoa, Vanuatu, Thailand, Solomon Islands, various other countries in the region. And what I have noticed is health security is a mosaic of so many different components. In Papua New Guinea, you might have a situation where you don't have enough surveillance of infectious disease outbreaks. I use it only as an example. In Samoa, you might have a situation where health information systems need to be more connected with electronic medical records. In the Solomon Islands, there may be tensions with Papua New Guinea in terms of the spread of multi-drug resistant TB, which is only 50 kilometers away across the sea. So to say that health security is dependent on just one set of criteria, and I know we're going to come to that in due course, but to say that it can be categorized according to certain indexes or whatever, I think is missing the point that health security is dependent in the region on so many different factors: monitoring and evaluation, availability of healthcare workers, training, surveillance, communications, the list goes on.
It does. You spoke about it, index. I want to pull on the Global Health Security Index. You know, this is an assessment of global health security capabilities in 195 nations. It's prepared by Johns Hopkins Center for Health Security, the Nuclear Threat Initiative, and the Economist Intelligence Unit. And so they assessed in 2019, then again in 2021, so just a couple of years ago, that all countries remain dangerously unprepared for meeting future epidemics and pandemic threats. You know, our audience will remember, they'll remember well that on January 30th, 2020, the WHO declared a public health emergency of international concern. One of those events you can remember where you were. And this lasted for more than 3 years. And it just was that international concern was lifted on May 5th of this year, right? 2023. This did not signal the end of the pandemic, but that the global emergency had ended, right? For now. So here we are. The COVID-19 global emergency has ended, and all countries remain unprepared to meet the next epidemic and pandemic threat. When you think about the Global Health Security Index's 6 categories, I think just real quickly of them as prevention, detection, response, systems, norms, and risks. You can speak on toward any of these, but as we think about this, this preparation that we should be doing, I wonder if you might speak a bit about the systems, the health systems, and how that is different depending where you're at, but how crucial it is irrespective of where you're at.
Absolutely. And James, you know, you put it so well. This is just an aside, but I had never really thought about it before that when COVID began and we all really did, we all really do remember where we were at that time. And it was such a seismic event that, again, this is off on a tangent, but I wonder, have we really processed it? But it relates actually to your question, because if you recall, certainly my impression, my experience was we dealt with COVID as best we could. In my opinion, we triumphed, not just as a country and not just as an institution, but as a civilization. It was remarkable. It was potentially the most dramatic stage of history that any of us will live through. Who knows, in our lifetimes.
You know, before you go further, I was reading your latest book. This one came out in 2023, right? Outbreaks, Epidemics, and Health Security. Very interesting. But I've gone through it a couple times, and it was the second time through that I looked at all the pictures you had. And I thought to myself, I'm so glad that Bass captured all these different pictures that remind us of what it was like during that period. If we think back on it, it was different. Yeah. And you've captured it well here, but continue on this, and of course, health systems.
Yeah.
Continue.
Thank you, James. And as I said, I'll try and relate the 2 points, but it was so surreal at the time, at least for me. I guess I was lucky to be, you know, academically, intellectually engaged in what was happening. But for a long time, it was just a question of getting through the pandemic, getting through the vaccination, getting through the recovery. And most people's instinct, I believe almost to this day, are to avoid the subject.
Yes.
It's something that people are a little bit burnt out on. And I don't think we could have done this webinar any sooner, to be honest.
Fair.
It was a time, it was a joy to be away from COVID and not to think about pandemics, considering, especially in the media environment, how immersed we were in all the statistics, all the breaking news. All people were doing was eat, sleep, and drink COVID. So to try and relate that to health systems, the idea here is the stronger the health system, the less you need to worry about health security. In a way, that's what it boils down to. If you recall, countries like Sweden, had very liberal, progressive, you might say, approaches. Some people said, okay, this is irresponsible. What people forget is Sweden is an extremely affluent, well-organized, structured democracy with an amazing public health infrastructure. That was already there. The key indicator for COVID and probably for future pandemics ended up being not number of infections, not even number of deaths, hospital capacity.
That's right.
Was what it boiled down to. You could have a functioning society if you had enough space in your hospitals. Okay, I'm exaggerating, but that was my conclusion.
Well, you know what? Yes, and when you think about this health system capacity, I mean, it's measured differently. I mean, maybe not differently, but there are different measurements to be able to determine what your capacity is. It must be measured in equipment and resources, in personnel. What was your experience when you think about this?
All of the above.
Okay.
Communications, of course, like part of my work also involved the real coalface element of going into the storage areas and seeing, are the drugs expired? You know, seeing also, have the registers been filled out reliably and in keeping with other records, checking, are the latest guidelines in place, and do the community healthcare workers acknowledge these guidelines? So I say it's all about resources, it's all about money, and it is. Yeah. But also it's about these fundamental building blocks that are not as dependent on resources. And if you have dedicated individuals as part of your health system who are given that recognition, you're going to have a good health system.
So before we leave this topic on health systems, I reading through your barefoot global health diplomacy. I mean, even the cover, if I remember right, I mean, this is a health care unit in the Solomon Islands. Is that right?
Correct.
And you had mentioned that it was, if I recall right, that it was, you know, some couple hours or so by a boat out into the back 40, as we might say. And I was struck by the health system is so different depending on where you're at, and the amount of resources or policy or priorities that are placed towards this can have a huge impact on the quality of care that you might receive in your community, and then your ability to be able to take any bump upward trajectory in any type of outbreak or anything. You did 100 of these missions. You must have seen quite a difference in systems, healthcare systems.
I did, and you know, the word that comes to mind is resilience. Okay, it's another term that we're hearing a lot about these days. But what you describe epitomizes resilience. Can your health system deal with shortages? Can it deal with outbreaks? Can it deal with public health emergencies, unexpected threats? What is the spare capacity within your system? And what I was really struck by on so many of the missions that I was privileged to go on is how much resilience comes from within. How much of it is to do with the human spirit, if you will, and not just that, but also the basic human intelligence, adapting to our environments. I know that there was a question about traditional cures, traditional healing, optimizing those elements, working with what we have. It's in our DNA. It's one of the most fundamental aspects of human and animal survival. And I think if it were not for that, health systems around the world would not be as strong as they are.
Oh, thank you for sharing that. I want to try to move the conversation to this role of technology and innovation. and it's how it has enhanced this health security that we've been speaking about. And when I think of this, at least from my layman's point, I was thinking about mRNA, the messenger RNA, or those vaccines, the immunization, the predictive modeling, the electronic medical records, which you actually had referenced a little bit earlier. I would note, at least for our audience, that just last month, the 2023 Nobel Prize for Physiology or Medicine was jointly awarded to Hungarian-American biochemist Katalin Karikó and American physician and immunologist Drew Weissman for their joint discoveries concerning nucleoside-based modifications that enabled the development of effective mRNA vaccinations against COVID-19. I guess I would ask you to share with us these potential uses for mRNA. I mean, we used it, as I understand, only exclusively now for the COVID-19 vaccinations, but that, I guess, represents the beginning, not the end of these potential uses. And so you might talk to us about that, but then your other broader experiences with immunization as well. Would you take it from there?
Thank you, James. You know, I think, well, to begin with, the mRNA was not initially particularly well received. You know, so much about COVID was, again, as we said, driven by politics, economics, media, that people, at least in my experience, did not have complete faith in this new system of vaccination, whereby at the molecular level, it's about teaching rather than introducing a small element of the actual disease so the body can develop its immune response. There's a lot for people to take in. There was so much happening. There was so much unhappiness in the world, and so much suspicion. We all remember the way emergency use authorizations were pushed through. We all remember the way the vaccines became mandatory for many people. It was a very challenging time. What emerged from all that, I think, although it was difficult for many people, is a new wave of vaccines, of healthcare options built on these mRNA vaccines that not yet, but that may yet solve a lot of the health challenges in terms of infectious diseases and health security that we haven't managed to overcome. I'm talking about even tuberculosis, let alone multi-drug resistant tuberculosis, malaria. How timeless is the malaria challenge, especially again in the region here. HIV/AIDS, we've heard so much about it. We've invested so much in it. People have made such efforts. Still, there hasn't been a reliable and effective vaccine, let alone the dark challenge of Ebola-like epidemics or pandemics. I mean, if you combined COVID with Ebola, you are really looking at a very dark, catastrophic pandemic. I'm not saying that's going to happen by any means. It may not happen for a long time, if ever, but if and when it does, the key to the COVID experience is it's prepared us for what's coming next. So rather than seeing COVID as the ne plus ultra, the great pandemic, it is merely, I believe, a stepping stone in preparation for the challenges to come.
Thank you for that. I want to talk a little bit about some other technological solutions in improving health security here in the region. You had spoke even about the electronic health records, and I, read about and thought about that, and I could see clearly how it makes more information available if, in fact, it's accessible. And the first time a doctor is pulling on the history isn't the oral one you're giving them right now, but there must be others. But you spoke a little bit about electronic health records. Maybe you might tell us a little bit about what you saw in that, or some other innovations as well, if you'd like.
It's again, and thank you, excuse me, it's to do with the benign side of technology and communications. We live in the midst of the technological revolution. A lot of it, is somewhat superficial, let's say, and it's comforting to think that the real things that matter beyond, I'm not saying anything bad about Instagram or Facebook or anything, but when it comes to human health and those things, it's really cool that the technological revolution is contributing to things like health information systems, electronic medical records, communication, surveillance, the way that outbreaks can be automatically graphed, tracked, shared upwards, not just to the national, but to the supranational level. This is the world we're living in. So here's to technology. It's underappreciated as a tool in the battle against infectious diseases.
No, I think you're right there. Let's talk, if you will, about some recommendations for bolstering health security efforts in the Indo-Pacific. I may be thinking about, strengthening regional collaboration, investing more in health security infrastructure, enhancing laboratory capacity. Clearly, we can talk about a lot of things. Take us off in that direction.
Again, I think it's the mosaic, but it's not just that. It goes way beyond just the health sector. It goes into education. It goes into security. It goes into what is the role of a defense department when it comes to health security? What's the role of a Department of Education, of Agriculture, of climate change? It's a stage of human history, I believe, where all of these different tools that are available to us, all of these synergies are allowing us to work in a much more streamlined, focused way. And the building blocks, like you said, their health information systems, it's monitoring and evaluation, it's research, it's human resources for health. The list goes on.
When we talk about strengthening collaboration, and you gave examples about whose role is it anyway, right? That could restate it like that. There must have been, from your own experiences, a fair amount of collaboration. You worked for some organizations that pulled people together, that did different things. It couldn't have been just you out there alone. Maybe it was, but maybe you could talk about how you saw how collaboration mattered if you were going to get certain things done.
Yeah, thank you, James. And again, what better way of relating my own experiences to the mission of the center? Because here, in this very auditorium, we see people from all different backgrounds, all walks of life, different countries, different disciplines, working together collaboratively. And of course, it's one of the most inspiring things, I know you agree, about the center. The idea, in my personal experience in the field, is to be able to work to people's strengths. So you may have an auditor, you may have a consultant, you may have a security person, you may have a WHO person, a United Nations person, a local doctor, a local nurse, other community representatives, all together in the same room. And there's no need for me to say to you how important it is to avoid hierarchies in those situations. All qualifications, to be honest, go out the window, because very often you are going to get the most insightful solutions generated from the people who on paper may have the least academic or technical experience. So you talk about collaborations. I can tell you that when you are on a 2-week mission, far out into jungles or deserts or rural areas, and you're with people you've never met before, and you have to work with each other. All you can end up doing just to survive is to play to your strengths and to try and bring out the strengths in others. And we all have our own our strong points and weak points. And I guess we treat it as a learning experience, try to remain humble, and give everyone a chance to talk.
Thank you for that. As I had mentioned at the top of the show, we have received several questions that were submitted at registration. So we're going to turn to those now. We've got, I don't know, we've got another 20 minutes or so. We've got several questions, and so we'll work our way through some of these. This first one, I think we've talked about it, but let's address it at least one more time. Why is health security significant in the Indo-Pacific region?
You know, it's a region of consequence, right? I think that's how we tend to describe the Indo-Pacific, although every region, let's face it, these days is a region of consequence. If we think about the specific characteristics of the Indo-Pacific, let's say, for example, climate change. How does that relate to health security? And here's an anecdote from my time in the Solomon Islands. Diplomatically, the Solomon Islands was doing its best to assist neighboring countries such as Kiribati. They were facing challenges in terms of resettling local populations, coastal populations affected by climate change. So Solomon Islands opened the door, opened their arms and said, we'll set up communities here, you can come to us, we'll resettle people in our rural areas. So a beautiful story of climate change and diplomacy. What was another facet or element of that story was the public health aspect that resettled, relocated populations, migrant populations, climate refugees, bring with them their own public health issues. That's not to stigmatize them, it's just the reality of people moving from one part of the world to the other. That in turn required a response from the health system of the Solomon Islands in order to make sure that those health issues were contained and didn't lead to social divisions or alienation. So many elements are in play here in the Indo-Pacific. I'm just using the climate change element as an example, but of course it connects to society, economics, politics, health, and security. And with climate change being such a feature, so highly placed on the regional agenda, I think it would be a mistake for us not to just focus in on that for a minute and think about it in the context of health security.
Well, you know, you reflected the words back to me again about regional consequence. And there are many reasons, of course, but the global GDP that comes out of this region is larger than other regions, right? You spoke about your analogy about a house and its health, and frankly, if this region had to even temporarily restrict its flow of trade and or even personnel or things, it would quickly start feeling it. It wouldn't feel it just here; it would feel it globally. You know, clearly, COVID-19 is forefront in many lived memories. But out of the region, we had SARS and MERS, and they also shut down for a period of time locations, or they restricted certain travel that would go through. And there were certainly economic impacts even for those types of events if we think about the region. Yes?
Absolutely. You put it actually even better than I do, because you bring your own perspectives on security and regional stability to this discussion. In fact, you probably have better insights than I do, but no question that the region is so dynamic at the moment. You know, there are so many stresses, both domestically and internationally, on the countries of the region, that you combine that with its history as an incubator of infectious diseases. You combine that with the climate change threat. You combine that with human mobility and migration and other economic challenges. And you have a situation where even on a global level, the people in Geneva, the people in DC, the people in London or wherever are thinking about the Indo-Pacific in this context. And they're not just thinking about the Indo-Pacific, they're thinking about themselves and how in the modern world we're so close to one another.
No, thank you for that. I want to, I think, build from our discussion about health security and its significance, and then we'll ask the very obvious question. Okay, it's important. Now, how can governments find common ground for cooperation and health security? And if we can find common ground, what might be, some of that action plan? What are some of the elements we might ought to get after?
I think it's the future. I think it will happen organically. That's my belief. Maybe I'm too optimistic, but we're moving more and more towards cost-effective and streamlined governance mechanisms. And one of them, as we discussed, is combining your remits, better coordination across departments. And even within that, the questions remain. The US is one of the most progressive, innovative countries in the world. In the US, there's a very advanced health component within Department of Defense, within the State Department. You have Office of Global Health Diplomacy, you have Office of Biosecurity. It's a model for so many other countries, but it's also trial and error. No one has perfected this system of governance that breaks down these walls that used to divide both job descriptions and governance responsibilities.
No, I mean, you're right. And the lived experience and memories of the region and the people who inhabit here will not soon forget what we've gone through. And we would hope that in this cooperation, we're willing to share information. We're willing to report quickly if things happen. You talked about, resources or remit and transferring of those, because if we're not safe someplace, we're not safe someplace, another place. No, that's absolutely perfect. I think those are, in fact, elements of an action plan that we would start patching together. Another question comes in and asks us, is there an ongoing initiative to apply lessons learned from the spread of COVID-19 within the region?
I know that there is, of course, and it's not just me, it's widely known that there are think tanks, there are reports, there's the talk of a regional health security development center developing located specifically in Asia along the lines of CDC or WHO. It is happening. But what I think is perhaps even more important is the fact that these dynamics are happening implicitly as well as explicitly. Human behavior has changed and evolved as a result of the pandemic and all of the distress it caused. People do not want this to happen again. And I think human behavior has elevated health in our minds from something that is just a personal thing or a family thing or a community thing into a national issue, into a social issue, an economic issue. And I don't think that's going to go away for a long time, if ever. And that change in the mindset means that because we all dread the prospect of another pandemic, people are much more responsive in terms of day-to-day life, in terms of behavior, in terms of what they follow in health concerns, both their own and locally. I think it's been a real paradigm shift that is going to possibly save humanity in the long run.
I'm glad you went there, because this next question asks us, how can health security influence a country's overall security? And particularly, they're asking about this region, and then what types of examples? And you said, might save humanity overall. And when we think generally, when people think about that large level of security, we're thinking about this bigger security. But it's almost like you can't have one without the other. You can't have a healthy family without security as well, or the other way. But please take it from there.
No.
Health security influencing a country's overall security.
And I would go one step further. We have the transnational security cooperation course coming up. I think those three words are totally pivotal when it comes to the future of national security. It's the same with climate change. You can have your own country can have a perfect, watertight climate change or health security policy. It's no good if the country next to you doesn't. The chain is only as strong as the weakest link. And what I think it means for humanity, not to go too far into the future, but it's the concept of common external threat. And there is nothing that will unify dividing factions, divided countries, divided regions more than the common external threat. That's where I think pandemics, climate change, environmental issues, that's where they act as a unifying and benign force.
Thank you for that. I want to switch the conversation a little bit. One of our audience members asks this: how might the Israel-Gaza conflict impact health security in our region? And so, as I was thinking about this, I was thinking about, how it could clearly divert international attention. There's only so much bandwidth even politicians and diplomacy can put in a certain issue, resources, but thoughts. Have you thought much on this yourself?
Well, what a world we live in, James. I'll give you an amusing example is that I just come back from California, where I was on a farm for a couple of days. And in this very tranquil rural setting, all people wanted to talk about was what was happening in Israel. Now, there's nothing wrong with that. Yeah. I think it's great to be aware of the news. It's great that we're so connected. But what it really brought home to me is that we are no longer separated, no matter where we are from these events far across the globe. It's not just in terms of the media and communication. Think back to the CSC course 22-1, Ukraine conflict began, Ukraine, Russia. It's all people wanted to talk about. And we were faced with the challenge, where do we draw the line? We're meant to be talking about Indo-Pacific security, and people want to talk about Ukraine, of all places. And yet what we came to, the conclusion we came to out of that course is that the connection is there. And again, I'll just emphasize this point one more time, this common external threat idea. Think about how bad Russia, Ukraine is, Israel, Gaza conflict. Think about how bad that is, not just for the protagonist and the antagonist. Think about what it's doing to the environment. Think about what it's doing to health systems, to the risk of infectious diseases spreading around the world. So without exception, whether it's Israel, whether it's Ukraine, conflict weakens us as a global community in terms of health, in terms of environment, on every level.
Yes, I mean, this destruction is the antithesis of development. No doubt, our audience members that thinking on this are, as we look at the great human toll, whether it's in the Israel-Gaza conflict or the Ukraine one that you brought up, our hearts go to those that are suffering, and there are many that are suffering. And so then they extend that back to themselves, and people start to think about, the reverberation or the impacts that it could have. And so no doubt that was part of the source of the question, as people were extending their own concerns for others back home to themselves.
Exactly.
This next question asks us about what roles do quarantine agencies play at the national, regional, and global levels. We certainly saw the use of quarantine agencies globally more than perhaps any time I can think of previous.
Yeah, again, hard to believe, James, that we've just lived through this. To me, and I'm sure many others, thought this was part of the history books.
Yeah.
This was like Ellis Island
Right.
kind of territory.
Mm.
It was to do with what they call cordon sanitaire, a reverse cordon sanitaire, all these old techniques going way back to the Middle Ages of quarantining, of isolating areas of outbreaks, or of creating a bubble of protection while everywhere else is suffering. It was effective, of course, only to a limited extent when it came to COVID. However, I think we've learned from that. I think it is part of modern life, and in a way, the irony is the more mobile we become, the more these quarantine facilities become relevant. They are essentially, in many places, the new national borders.
Yes.
If you think about the European Union, where borders have become less relevant, softer and softer, yet the quarantine argument is what maintains a certain degree of national integrity. So they're not perfect. They are essential. I've traveled many places in the world where I've had to bring my WHO vaccination booklet and shown people my stamps and my medical records. To me, that was part of my life. And I think it would be a mistake to say, look, this is none of your business. One's personal health is in many ways related to the health of the community. And that's what quarantine agencies and stations and organizations do.
You had mentioned about creating a bubble, and I, in my mind, went to what some have referred to as a securitization of health, to keep some protected at the expense of others. That would be a view, perhaps, of those who have less, are worried that we're trying to make this distinction. And I think it's probably a cautionary tale against how we advance health security so that it is not misperceived. But thoughts?
I think it's the perfect segue. Okay, one example, of course, is Ebola.
Yes.
The way that was managed in a very north-south kind of way, right? And people did not think necessarily all the time about the sacrifices that were being made by local people in Sierra Leone or wherever, in order that Europe, the US, might better protect themselves. So one of the major initiatives that I'm working on now as part of my UN honorary position is the idea of universal health security versus neocolonial health security.
Oh, yes.
And it's so insightful that you should mention that. There is not really an approach to health security, in many people's opinion, that pays adequate attention to the needs, concerns, stakeholders of the global South.
Yes.
We think of health security automatically in terms of not necessarily neocolonial way, but we do think of us and them. We think of diseases as coming from poor places and threatening more affluent places. And yet that comes with so much negativity.
Yes.
And ultimately, the concept of universal health security or a Southern-driven health security model is most likely, at least in my opinion, going to be much more effective for everyone.
Oh, thank you for sharing that. We are coming near our end. Let me of the show. Let me go here. How can we communicate the seriousness of epidemic threats to an increasingly indifferent and unresponsive public?
That's I would not want to end on a negative.
All right. Well, we'll go to another one then. Go with that one first.
I think we can make this positive.
Okay.
And here's the example I use. I may be wrong. Television, 1950s. Okay, came on stream and people were dazzled by it. It governed a lot of society in a way at that stage, until people reached a point where they were a bit more selective about what they were watching on Netflix or whatever. They don't want to watch the ads anymore. We're at a stage, we're at that stage in terms of internet, global communications in a way. And we're a deer in the headlights at the moment, and we're being dazzled by it. But I think as we become more selective, the goodness will arise. And like we said earlier about communications and health systems, the media being more objective, more fact-based, maybe less opinion-based, better reliance on certain news sources. As we edge closer to that, and I think it's happening actually pretty fast, within the next 5 to 10 years, we're going to be in a much better place in terms of this connection between technology, media, communications, and health.
Thank you, Bas, for sharing your time and these invaluable insights. But before we conclude, I wondered if you might share with us a book recommendation for our audience.
Well, the first one, James, that springs to mind is one called Global Health Security by Lawrence Gostin. Larry Gostin is a very distinguished professor at Georgetown. He is a colleague and a correspondent of mine, always supportive. But the amazing thing about this book is you can open it on any page. You're going to see the word COVID or coronavirus. So the two have become almost synonymous. And yet it manages to do what we've tried to talk about today, taking those key lessons from the pandemic and generalizing them for the benefit of the future of humanity.
I hope that this conversation inspires each of us to be more actively engaged in health security initiatives, while we recognize the significance of working together to create a more cooperative security. Thank you, Bas. Join me again in 2 weeks when I assemble 3 uniquely talented experts to discuss the changing nature of security in the face of climate and environmental disruption. Our guest will be Dr. Ethan Allen, a biologist specializing in environmental and climate-related matters, Dr. Srini Sitaraman, a security specialist with a sharp focus on geopolitical implications, and Dr. Sebastian Kevany, an expert in global health, who spent this time with us today. He will complete our trio of guests. For that show, our conversation will delve into the mounting risks associated with climate-induced conflicts and health security challenges, their intersection with national security concerns, and the urgent need for sustainable adaptation strategies. With that, this has been the Security Nexus webinar. I'm James Minnich, and I urge you to stay vigilant and well-informed. And until we meet again, aloha oi.